Okay, once again welcome to the Gain Education YouTube channel. So today we will discuss about the alteration in body temperature. As per the students vote, the alteration in body temperature is the highest. We are going to do the alteration in the body temperature itself. So as I said, in the normal temperatures of the healthy adults, we must know before going to for the knowing about the alteration. So in the Celsius, we have discussed that 37 degrees Celsius. In the range I said that 36.5 to 37.5. In that case the range, so if it is average comes, oral temperature is 37 degrees Celsius. And in the Fahrenheit 98.5 degree I said, axillary temperature 97.5. So little bit it is near. Okay, so axillary temperature 97.7 degree Fahrenheit. Okay, rectal temperature 99.5 degree Fahrenheit, tympanic temperature 99.5 degree Fahrenheit, same. So tympanic and rectal will be same as I said. So forehead temperature, that you can think that is infrared. Okay, what it is? Infrared temperature. Okay, infrared, from the infrared thermometer they are checking the forehead temperature. Okay, next, sir, what is the fever then? So fever, it is not a disease, it is a sign. Okay, it is a sign to protect the function of the body with a suitable temperature for a cell to do the function efficiently. So in that temperature only the cell can do the function due to due to the invasion of an organism or due to the hyperthermia. Okay, so you will know about what is hyperthermia and all. So first of all, to do the cell to do the normal functioning in that situation, it will adapt to the such a temperature so that it can do the function. More than 99 degree Fahrenheit, 99 to 106 degree Fahrenheit. Okay, so if it is more than 106 degree Fahrenheit, that will causes the necrosis. Okay, so the death of the tissues can begin. Clear? Okay, we'll start with the pyrexia. We know that what is pyrexia means, it is a fever. So for the hypothermia, we should say, we should not say for hypopyrexia, because fever is only the increased body temperature. We can't say for the decreased body temperature, we can't say hypopyrexia, we should say hypothermia. Okay, so now we are discussing about the hyperthermia. We are discussing about the pyrexia means what? Fever. So in that body temperature is above the normal range. So it depends on what it is, oral, axilla or rectal or infrared or tympanica, that will depends. Okay, hyperpyrexia, this is very important, more than 41 degrees Celsius, or in the Fahrenheit you should say that is 105.8 degree Fahrenheit. Febrile means with the fever, person will be called as febrile. Afebrile means the person without the fever, as I said. Clear? Okay, so here in the irregular fever, that mild pyrexia means 99 to 100 is mild pyrexia. Moderate pyrexia means 100 to 103 degree Fahrenheit. High pyrexia means that is 103 to 105 degree Fahrenheit. Okay, so more than 105.8 degree Fahrenheit will be called as what? Hyperpyrexia. It is there. Okay, more than 105 degree Fahrenheit will be called as hyperpyrexia. So be aware of Celsius also, 37.2 to 37.8, 37.8 to 39.4. So these readings also you must know in the degree Celsius and also in the degree Fahrenheit. I hope you understood this one. Now hyperpyrexia. In the hyperpyrexia, more than 41 degrees Celsius or more than 105.8 degree Fahrenheit, isn't it? So hyperpyrexia where it can able to start to get die. Okay, that is death of the cells can be initiated due to it is near borderline to the 106 degree Fahrenheit in the hyperpyrexia. So in that example is intracranial hemorrhage. So in the cranium cavity, so due to the increased hemorrhage that can be happen. Hyperthyroidism is also one of the example where the T3 thyroxine and thyronin will increase. Okay, so that metabolic function also increase. Due to the increased metabolic function, there is a increased temperature. Okay, yes. Coming to the subnormal. So before going to the subnormal, just I want to say you what are the mild, moderate, high, and also hyperpyrexia. I hope you understood this one. Coming back to the types of the fever, we'll see one by one what is the types of the fever. Intermittent fever, wherever the spike, daily, first day, second day, third day, fourth day, so it will rises and it will comes to the normal. Rises, comes to the subnormal. Subnormal, it rises and comes to the normal. So if it is happening like that, so in the most of the cases like malarial cases, we will see this one. So there is a spike will be there. The spike will be there, and there is a regular interval, it will comes to the normal also. That is intermittent fever. So it can be 24 to 48 hours. It can return to the normal. Next, remittent fever. So remittent fever, it will be more than 2 degrees Celsius in 24 hours but never reaches to the normal. So once if it is raised to the now this is a 30 36 degrees Celsius, you think this one is 37, this one is 38. So it rises to the 2 degree and again it will rises 2 degree, again it will rises more than 2 degree, again it will rises to the more than 2 degree. It will never comes back to the normal, but it rises more than 2 degree Celsius itself. Most of the that influenza cases we will see this. So there is a wide fluctuation. There is a wide fluctuations will be there, it will never come back to the normal. That is remittent fever. Next, relapsing fever. So relapsing fever means there is a person with the fever, person with the without fever. So you should not think two people here. So for the same person, for the same person, 2 3 days, 3 days there is a fever. 3 days will be the fever, and other 2 days or 3 days again there is a normal person. Again 3 days he will be called febrile, and again 3 days he will be called afebrile. So it will takes for a over a days, over a 48 hours to 72 hours. There is a brief alternating in febrile and afebrile periods. That is nothing but relapsing fever. I hope you understood this one. Next, constant or continuous fever. Constant or continuous fever means you can think less than 2 degrees Celsius, or you may think that less than 1 degree Celsius. Within that range only it is getting variation, but it never reaches to the normal. Next, so where we will see in the typhoid cases, we will see the continuous or constant fever. Next, see, you can see it is a 38 here, in between where this 39 will be there. So it is never reaching more than, but it is within 2 degree Celsius. Clear? Next, crisis. So before knowing about the crisis, we need to know about the defervescence or decline. So that I will do afterwards. So we'll come to this one later. Coming back to the causes of the pyrexia. So due to the resetting of hypothalamic set point, so due to the myocardial infarction, that time what happens, tissue injury will happen. Due to the tissue injury, some cytokines will release. That cytokines will reset the hypothalamus to have a fever. So infections like bacteria, viral infection may also causes the pyrexia. Always do remember, fever is not equal to infection. Fever is not equal to infection. The fever may be due to the hyperthermia. That fever may be the due to the hyperthermia. What is hyperthermia? I will tell you afterwards. tissue injury, myocardial infarction, pulmonary embolism, cancer, trauma, surgery. All these are causes of the fever. Clear? Okay. Excuse. Okay. So course stages of the fever. Okay, in this onset fever means it is the beginning of the fever where suddenly if it is occurring sudden fever, that is due to the pneumonia. Gradually if it is occurring, that time we can say it is typhoid. Okay. Yes. So fastigium, I will tell you the graph here. Okay. So there is an invasion of the bacteria that will rises. Okay, due to the invasion there is a rising of the body temperature area. Rapid. Okay, there is a rapid rise. Okay, rapid rise. After a certain point, it will remain constant. It will remain constant. Not even a single degree Celsius it will changes or varies. Okay. So suppose I say the 103.8 degree Fahrenheit, it remains as it is. Okay, this plateau phase. Okay, this is a stadium, or we can say it is a plateau, or we can say it is a fastigium. What you can say, fastigium. So this phase, constant phase for over a period of days, that is nothing but fastigium. Okay, this is a first invasion of the bacteria, that is rapid will occur. Later on at the point it will remains constant, that is that one will be called as fastigium. uh, After that it will get relief from the infection, so that there is a decline, or we can say that is defervescence. Okay, so it is declining. So in the declining also we have two types, whether it is crisis, whether it is lysis. I will come to it. So you understood this one? Yes. Invasion will be there, fastigium or plateau or stadium phase will be there, and declining phase will be there in the temperature alteration. Okay. So first we will see the onset, how that may be sudden or that may be gradual. We already finished that. Next, fastigium, temperature remains consistently high. So it remains consistently high only, it will never comes back to the normal. Okay, and never alters even point degree Fahrenheit also. Next, declining defervescence, that means what here there is a declining, it is coming back to the normal, returning to the normal, that is nothing but defervescence. So 4 to 5 degree Fahrenheit variation, that will comes back to the normal. How it happens? Through the heat loss, that most commonly we can say through the sweating. So sweating is a which type of heat loss? Evaporation, isn't it? Yes. Now in the defervescence we have two types, I said, crisis and lysis. What is crisis? When we say crisis, the crisis, if it is sudden fall, okay, sudden fall in the temperature, that is, so defervescence itself, declining itself, but declining declining very suddenly or rapidly, that is nothing but what? Crisis. Lysis means what? There is a gradually it is declining, not suddenly. Okay, that is lysis. Okay, what is that? Lysis. Sir, in the crisis we have again two types, sir. Yes, in the crisis, true crisis is there and false crisis is there. Sir, what is the meaning of this true crisis and false crisis? True crisis, okay, true crisis. So if there is a sudden fall in the temperature with the improvement in clinical symptoms, okay, then it is true crisis. False crisis means, what is the meaning of false crisis? There is a sudden fall in the temperature from highest range, but it is without improvement in clinical symptoms. If the clinical symptoms is not improved, then it is false crisis. Lysis, we already said, it is gradual fall. Sir, what are all the symptoms that can be improved in the true crisis, and what are all the symptoms that never improved, and how we can identify by this one? Okay, so true crisis, improvement in the pulse stabilization, and the skin is warm and dry. patient looks better. Okay, clinical improvement will be there as a evident. Okay, next, false crisis. Temperature falls suddenly but often touching to the normal too, but clinical improvement is in general conditions. Okay, only in general conditions it will be uh, improved, but not everything. Pulse is weak. Okay, and patient look exhausted, very frustrated. Okay, next, skin looks so cold and clammy. Why? Because there is a vasoconstriction. So due to the vasoconstriction, what happens, the patient skin will be cold. Okay, you please do remember that. Okay, it indicates what? Danger and complication. If the already fever has declined very fastly, but still there is a cold and clammy, if it is there, and the patient looks exhausted and pulse is weak, that time you should think false crisis. Okay, yes, so we did that up to there. Now, so we have discussed up to hyperpyrexia for 41 degree Celsius, more than 41 degrees Celsius, right? So subnormal temperature means what? So 98 to 95 degree Fahrenheit is a subnormal temperature. So less than 94, sir, less than 94 degree Fahrenheit will be called as hypothermia. What we call less than 94 degree Fahrenheit? Hypothermia, isn't it? So hyperthermia means what? It is more than 105 degree Fahrenheit itself. Sir, you said hyperpyrexia is also 105 degree Fahrenheit. Yes, hyperpyrexia is also 105 degree Fahrenheit. It is due to the fever. Okay, it is due to the fever. Hyperthermia is not, it is not a fever. It is due to the side effect. It is due to the side effect or anesthetic effect. Okay, anesthetic effect that will get a increase in temperature. Suppose if I say in the bowl, uh, externally, if the sun is, if the sun or externally anything, it is inducing the heat, that time your body, the body temperature will rises. That doesn't mean your body has a fever. It is due to the external future. Okay, due to the external heat source, your body will get what? Your body will get increased in body temperature. Okay, next, so how what are the examples we can see? Due to the sunstroke or heat stroke. Malignant hyperthermia, where post-operative cases, in the post-operative cases due to the anesthetic effect, malignant hyperthermia we will see. And in the antipsychotics side effect, like neuroleptic malignant hyperthermia we will see. Cocaine is another example. Okay, yes. So how we need to manage the hyperthermia? Causative agent, what are the causative agent? We need to know first. What is the causative agent? Sun, side effects of the drug, external beam of rays. You remove all these things. That means you can't remove the sun. You should remove the patient from the sun and make them sit in the cold place. Okay, so that he can be relieved from the heat. Okay, so remove the patient from the causative agent, first management. Second, if the airway is closed, that time you should look for the bronchodilators, and if it is secretions is there, do the suctioning. And cold applications, if it is more than 105 degree Fahrenheit, do the cold application up to 101 degree Fahrenheit. And very importantly, don't give the cold application at the chest. Okay, don't give the cold application at the chest. That may causes the coronary vasoconstriction. Why coronary vasoconstriction? So that may leads to the heart conditions, heart disease conditions. For that purpose we should not apply the cold sponge. Okay, yes. So cold sponge is which type of heat loss? That is conduction method, because the body surface is touching the cold surface. That's why it is said to be heat loss by conduction method. I hope you understood this one. Okay, we'll get into the hypothermia. Okay, we'll get into the hypothermia. Wait for a minute. Okay. Yes. Hypothermia. So we know that 95 to 98 degree Fahrenheit is the what? It is nothing but what? It is the subnormal temperature. Okay, so less than 95 degree Fahrenheit, 94 degree now. Okay, 94 degree Fahrenheit or 34.4 degree Fahrenheit, it will be said as hypothermia. Okay, so less than 94 degree Fahrenheit will be called as hypothermia, where we will see that when the patient is having body temperature less than subnormal, set by hypothermia. Shock, hypovolemic shock. Okay, whenever there is a decreased blood or decreased liquid in the body, that time we will get hypothermia, decreased body temperature. Okay, so what are the stages? We'll see mild hypothermia, moderate hypothermia, severe hypothermia. Okay, so mild hypothermia is 90 okay, 34.4 degrees Celsius. Okay, this is 34.4 degrees Celsius. Clear? So 32 to 34.4 degrees Celsius is mild hypothermia. 28 to 32 degrees Celsius is a moderate hypothermia. Severe is less than 28 degree, will be said as severe hypothermia. I hope you understood by the Celsius and Fahrenheit also. You look into it. 82.4 degree Fahrenheit to 89.6 degree Fahrenheit is moderate. Less than 82.4 degree Fahrenheit will be said as severe hypothermia. Okay, what are the management we need to do for management of hypothermic patient? Give the blanket to the patient, of course, and offer the hot drink like cold. You should not give the cold coffee. We should offer the hot coffee and tea. Switch off the fan if AC, if it is there, switch off the AC. Okay, so this one we need to do. Next, coming to the rigor. So rigor we will see in the malaria, and rigor is one type of intermittent fever. Sudden severe attack of shivering will be there in the cold stage, in which body temperature rises rapidly to the stage of hyperpyrexia. So there is a sudden, there is a what? Sudden, wait, okay, sudden there is an increase in the body temperature spike will be there. Again there is a cold stage. Okay, this one will be seen in the rigor in the malaria, where it is also example of intermittent fever. Clear? Okay, so what are the stages? First stage we'll see the what the stage we'll see, that is cold stage. In the cold stage the client is shivering. Okay, very importantly, uncontrollably 15 minutes to 1 hour. Okay, 15 minutes to 1 hour. Pulse is feeble and rapidly there is a tachycardia. Okay, there is a tachycardia. Teeth will be cluttering and you can hear the sound of the cluttering. Okay, so 15 minutes to 1 hour he was shaking, that means he was getting shivering. So in that case, what is the management we have to do? Provide the blanket and hot drink. Clear? Second stage, hot stage will be there. This is cold stage. Second stage will be the hot stage. That time what happens? Shivering will stop. So there is an increase in the body temperature from the subnormal. That's what we call about intermittent fever, right? So beyond 104 degree, or it is near to the 105 degree, 105.8 degree Fahrenheit, it is near to the hyperpyrexia. Okay, so patient will get more thirsty. Very importantly, in the hot stage there is a thirsty, in the cold stage there is a shivering. Okay, in the third stage there is a sweating. In the third stage there is a sweating. What happens? This is called declining stage. This is called declining stage. Temperature falls from 105 degree to less. Okay, so pulse improves, there is a improve in the pulse, sweating will occurs. Okay, so this is about the stages of the rigor that you need to remember. Where you can see the rigor, most of the cases like malaria patients will see the rigor. Okay, in the malaria patients, clear? Okay, so this is okay. What is the management of the third stage? In the third stage, what management we can do? In the second stage, there is a hot stage now, we should offer the normal drink. So we should offer the hot drink, where we need to offer the hot drink in the cold stage, normal drink in the hot stage. Okay, and give increase in the fluid intake in the sweating. Why? Because due to the sweating, evaporation through the heat loss through the evaporation, thereby that may causes the dehydration. For that we have to recommend fluid intake should be more. Okay, and change the cloth and blanket. Okay, change the cloth and blanket. So why we have to change the blanket and cloth? Because that may causes more sweating. Okay, so that we need to change it as it when it get more sweat. Okay, so and to prevent the dehydration, we need to increase the fluid intake. I hope you understood this class. In the next class we'll discuss further. Thank you for listening the class.